Okay, so you should be asked for permission about the recording. So hopefully everyone is okay with that. We do have a few students who had wanted to come but are unable to because of class conflicts and other meetings. And so I did say that I would record the session and hopefully make this available to them relatively soon here. And I know some people may need to leave early or some people may be coming in late. But just to give you a little overview of the evening, if all of you feel free to turn on your cameras if you're okay with that. If not, I absolutely understand. Sometimes it just helps to put names and faces together, especially if you're trying to connect with people. And so if you can, turn on your cameras, and if not, it's okay. I absolutely understand. It takes up more bandwidth, and hopefully we won't have any technical issues this evening. But in case we do, just bear with and we'll try and get through this as best as we can. When I asked students to sign up, I did ask them to submit questions if they had any in advance so that we could try and get through as many of them as possible. And so what I wanted to do is, just have our panelists start off by introducing themselves. And as part of that introduction, I think one of the most common questions that participants had is why you chose to pursue medicine. So if we could start with that, I'm going to try and remember where everyone's at. So we'll start off with those that are still in med school, and then jump to those that are doing residencies, and then those that are fully in practice here. Okay, so Taylor, can I have you start off?
Yeah, so I'm Taylor. I'm a third-year medical student at Creighton University in Nebraska. And then just why I wanted to do medicine. Is that the other question?
Yes,
okay.
Please.
I mean, I'm sure everyone's gonna have similar answers, but I particularly, and I'm sure it's changed since I was in undergrad, but what I'm most passionate about right now is the impact we can have on one life, and just like preventative medicine itself, how many things, like how many hospitalizations we can prevent. I want to pursue primary care and pediatrics. So I'm just really passionate about preventing illnesses, preventing future hospitalizations, preventing sickness. And I think that medicine in pediatrics especially will put me in a good position to do that.
Thanks, Taylor. Caitlin?
I'm here. So I'm a second year osteopathic medical student down at University Incarnate Word, San Antonio. And I guess why I chose to pursue medicine, similar to what Taylor said, I think it's like you can, like, health is kind of the basis of everyone's kind of like joy in life. And if you're not healthy, then, you're not having a good time. And I think also like the science base of it and really being able to interact with people, but also apply science and knowledge to it as well. And I'm just a second year, so I haven't gotten to go into rotations yet. So I don't know exactly what I'll be wanting to do.
And one thing I probably should have pointed out is that we do have some students in allopathic medical schools as well as osteopathic. And so for Taylor at Creighton, that's an allopathic school. Caitlin is at an osteopathic program. And so maybe that's something that you all can touch on in a little bit as well too. Sita?
Hi, everyone. I am Cedith Giddings. I completed my second year of medical school last year. I'm actually studying for my STEP. I am a student at Ross University School of Medicine. And just like my two colleagues before me, I'm interested in the sciences, but also being 2 years in, I am actually fascinated with all the skills that one possessed as a doctor, and being so intricate and being so unique when you're amongst people. And I'm really looking forward to gaining more skills. It's the skill sets for me.
Thanks, Sita. Hannah?
Sure. Hi, everybody. I'm Hannah, third year medical student from the University of Minnesota, first 2 years up in Duluth. And I am pursuing, as of like last Saturday, OBGYN. I declared for my electives. I decided to go into, I see snaps from Adam, thanks. I chose medicine over like other healthcare careers because my style of learning, what I feel to be integral to my like confidence and moving forward and caring with patients. I wanted that long duration of med school. It's a big commitment, but I was wanting that and ready for that. And yeah, like everyone said, I wanted to be walking along patients in some of the worst days of their lives as well as the best days of their lives, especially as an OB-GYN, touching on a lot of those sensitive conversations as well about women's health.
Great. Thanks, Hannah. Allie?
Hi, everyone. My name's Allie. I am a second year med student at the University of Minnesota Twin Cities. And like a lot of my peers have said, there's a lot of reasons why I chose medical school, but I think for me, to kind of sum it up, is that I've always been really engaged and involved in volunteering and giving back to my community. And I knew that I wanted to help people on a personal level. But I think the best way for me to do that was through science and medicine, because it was something I was so passionate about. And I loved thinking through systems and learning how the body works and being able to help people in that way. And so that's kind of why I've picked that. I'm currently going to go into my rotations in a few months. I'm still undecided, but looking forward to learning more.
Thanks, Allie. Stephanie?
Hi, I'm Stephanie McGill. I'm a third year at AT Still University, and right now I'm on rotation in St. Louis with BJC and Christian. And I am a non-traditional student, so I actually worked in healthcare before going to college. And that's where I found my passion for healthcare while working as a tech and a paramedic and such. But I found myself wanting to be in charge, making decisions. And I was just like maxing out everywhere with jobs of what I was allowed to do. So, if you just are really passionate and confident with your ability to serve, then, that's why I chose this route.
Okay.
And I'm a DO, sorry.
No. Thanks, Stephanie. Anil?
Hi everyone, my name is Anil. I'm a first year resident at Methodist Hospital here in St. Louis Park, Minnesota. I'm in the family medicine program. I went to Des Moines University, one of the DO schools, for medical school, now back in the cities, which is nice. What brought me to medicine, kind of similar to everyone else, they'll just have a big passion for just like the science behind medicine and how bodies work and stuff like that. And then I did a lot of work in undergrad as a CNA and as a medical scribe and volunteered at a few hospitals here in the cities. And I think all of those experiences kind of led me to medicine as well as the passion for the science behind it. So, yeah.
Thanks. Annika?
Hi, I am a first year resident at South Shore Hospital in Long Island, New York. I went to Georgetown Medical School. I chose medicine. I chose emergency medicine, and I think right now it's currently because I'm obsessing over procedures. So that's it.
Okay, thanks. Brittany?
Hi, I'm Brittany. I'm a third year internal medicine pediatrics resident at the University of Minnesota. And I think like everybody, there's probably a lot of reasons I chose medicine, but a big one for me was being a patient. So I had lymphoma during my first year of college, and I think that experience just made me feel like my oncologist made a huge difference in my life. And I saw a lot of opportunities to care for especially adolescents and young adults. And that kind of inspired me and has continued to be what inspires me to want to be an oncologist.
Thanks, Brittany. Jens?
Sorry, I was muted. I'm Jens Olson. I'm an ER attending physician. I went to med school at University of Minnesota Twin Cities and did training in Milwaukee at the Medical College of Wisconsin. I'm currently practicing in Waterloo, Iowa primarily, but also do locum shift ups in Bemidji, Minnesota, which is a very interesting place to work. I got into medicine, a lot of what everyone else said. I really was struck by the ability to see someone on the worst day of their life and do what you can to try and make it a little bit better. And I think Annika can identify that in EM, one of the things I love is that you get to see absolutely anybody who's able to pick up the phone, dial 911, and come in. Doesn't require any more resources than that. And I think that speaks a lot to what we're able to do.
Thanks, Jens. Adam?
Hey, I'm Adam Langer. I'm a third year, almost fourth year OBGYN resident. I'm in Dayton, Ohio. I did my first 2 years of medical school in Duluth and then finished in the Twin Cities. As far as, why medicine, pretty much all the same things you guys said. Really passionate about science and fixing problems and, helping people. And this was kind of just the best way to put them both together. And then somehow I ended up in, OBGYN and women's health, which I never expected, but it's been great and I love it. So.
Thanks, Adam. Kanisha?
Hi, everyone. Kanisha. I am I'm an attending trauma acute care surgery at Emory Grady Hospital in Atlanta. I did my training, medical school, University of Illinois, and my training back in Chicago, which was home for me before I went to Augsburg. And then I did my fellowship at University of Arizona in Tucson before joining Emory. For me, I went into medical school for preventive health, and that's what I thought I was going to do, medicine, family medicine, and that I was all for that. And then once I started doing my rotation, I was very surprised that I liked surgery. I actually just wanted to survive that rotation and just really fell in love with it. And then really, for me, choosing trauma was just really taking care of patients when they're at their worst and so unexpected. And I really enjoy it.
Thanks, Kanisha. Carly, you had asked a question about resources that our panelists utilize through Augsburg in order to meet their goals. Panelists, do you want to, feel free just to jump in, unmic yourself and respond to questions. And then Carly, if your question still goes unanswered, please feel free to follow up.
I have something just to start out with that I would say a great resource besides, of course, Katharina is URGO. You can get so much research done in undergrad, and I was able to get a research fellowship done as well because of my research experience. And now being in medical school, I don't even have to worry about it. I have enough research for 2 students. And so that just is a great opportunity. Do the summer programs, do academic if you can. I would take advantage of that because that's unique to Augsburg.
I would echo that as well. I think through URGO, there are a lot of opportunities provided to the undergrads at Augsburg. I did a Fulbright fellowship immediately after undergrad, and it was just through the URGO office in Dixie at the time that allowed me to do that. And that definitely, not only was it an incredible experience, but it opened the door to a lot of opportunities I wouldn't have otherwise had.
Augsburg's location gives you like limitless opportunities to serve your community, and you can rack up so many hours for your application for medical school. So the Brian Coyle Center, you can go to Hennepin County Medical Center. Around you is just so many ways that you can get a lot of volunteer hours, however you want to get them.
I took advantage of some of the out-of-state summer programs in addition to URGO. So I did a program called SMDP, and that's for underserved and people of the population. So I would advise, people to look into that as well if you want to, do other programs outside of Minnesota.
Yeah, I did something, a similar program. The program I did does not exist anymore, but very similar program in the summer, and I thought it was very valuable.
Brittany, do you want to say something about what you did during your gap year in your work with Health Commons?
Yeah, so similar to what Annika said, I think there are just so many opportunities to be involved in the Cedar Riverside community. And Augsburg is super, sorry, I have a puppy here. Augsburg is so unique in having a commitment to the community. And so I was an AmeriCorps volunteer working with Health Commons, which is a nursing-led health center in downtown Minneapolis and also in Cedar Riverside. Those are nurses that are faculty at Augsburg, and I learned so much from them. So this whole health center that any of you can also get involved in is completely focused on relationship first, and rather than any sort of assessment or treatment. So it's really all about a space to create community, and then from that, connect people to things that they feel like they need for their health. And then I also worked for Campus Kitchen and did a lot of healthy food work and work with farmers markets. And that's also an amazing opportunity, whether you want to be involved in the community garden or direct meals. And both of those things have continued to be useful for me. So I now work at a federally qualified healthcare center. That's where I have my primary care clinic. And so much of what I learned through Augsburg are things that I use every single day.
I can echo Health Commons. I didn't do like a gap year and work there for a whole year, but my senior year was able to go there like almost weekly or every other week for like a semester and a half, and it was amazing. The nurses were amazing and everyone there was amazing. They would let you talk to the patients and help them as much as you could. So it's a great way to get that experience before you're even in med school, and it would help you stand out against your peers, like knowing how to talk to people, knowing how to talk to patients in a way that would make them feel comfortable.
Going off of that. Oh, sorry. I studied abroad in Cuernavaca and was able to shadow like a surgeon down there for a while. But then in addition, just like learning Spanish, like being down here in Southern Texas, I use that on a fairly regular basis if I'm out in the community. So that also has been helpful.
Just to add, if Brittany, if you want to show us the puppy, feel free to, put it in the screen. And then also just an obvious resource is Katharina herself, especially if you don't know what you're doing, which was my situation. I remember like one time I was just like gonna drop biochemistry because I heard it was really hard. And she was like, you can't do that. Like you literally cannot do that if you want to go to medical school. I just had no clue. So meet with her and check with her, like, and trust what she says. So just all those little things.
Is Dale
Not
Peterson?
to,
Oh, sorry.
sorry. Not to go against what anyone else has said, because I support 100% of all of that completely. But there's no like fancy checklist out there of things you have to do to get to med school, or like the research, the shadowing, the community service. Like I am in full support of like following what your interests are. I decided to work at a Bible camp for a summer. I was in the Augsburg choir, and I was on the diving team for just 1 year at Augsburg. And those were like the three main things I was asked about during my med school interviews. And those I thought were least relevant to my medical career, or what would make me a great physician. But those like consistently through the interviews were what I was asked about. And it's solely because I was interested in it and I was passionate about those things. And I didn't follow the quote checklist of what people need to do to get into med school. So don't be afraid to go outside of that.
I agree with her 100%, but I think that's a prerequisite to get into most med schools. So that's a little bit different than like trying to look your best is all I was saying. Like make sure you actually can qualify for schools.
Like biochemistry, yes.
I was gonna ask, like Dale Peterson is still around?
Yes, Dale is still there.
Okay, great. He was really helpful when I went through the application process. So I think, whether it's Dale Peterson or somebody else in another department, but just having somebody who kind of knows the ins and outs of the application process and how to help you along is really important. He really helped me polish my application, and like Dale was key.
Yes, Dale is still in the biology department, still has wonderful advice. He's abdicated a lot of those responsibilities as far as application kinds of questions. Once I was hired, Dale was on the selection committee when I was first hired, and it's been about 6 years now. And so I know when Adam applied, Jen's, Kanisha, that was before I started at Augsburg. So I didn't have the benefit of getting to work with them on their application so much.
Yeah, and I applied to medical school after I left Augsburg, so about 1.5 years after I left Augsburg. So, but I think everyone was a good resource. And I graduated from Augsburg in 2003, so it's quite a while ago. But Dale Peterson was definitely a good resource throughout the time I was there. And Dixie was a great resource for me as well.
I was a chemistry major, and I can echo the biology. People are great. Dr. Michael Wenzel was amazing in helping me with my application. I would just suggest like any professor who you've gotten to know and can help you like personally with your personal statement, because it's kind of hard to write about yourself. Like someone who can help you think things through and help you remember things about you that you might not want to talk about because it's just weird to talk about yourself.
Yes, I would agree. Writing your personal statement is probably one of the most difficult pieces of writing that you'll have to do, but you need to get used to it because you're going to have to continue to write when you're applying for other things such as residencies still. So keep at it. And I know, Taylor, for you and those of you at the U of M, there is always that writing intensive requirement that some schools have. Creighton requires 2 writing intensive courses. The U of M Medical School requires at least 1 writing intensive course at an upper division level. So make sure that you keep that in mind as you're planning out your classes still. Let's see. Something else that Carly had asked about was what you do to combat financial struggles throughout the process. See some chuckles
throughout the process, like during undergrad, or
I think throughout the whole gamut.
Okay.
I think you can still attest to that, right, Kanisha?
Yes. Yeah. I don't know. It's basically you have to try to budget and live within your limits when you can. And then, I don't know. Honestly, I don't know. I think that you end up getting loans, obviously, for the most part, especially in medical school. And it's kind of hard to say how you really deal with it. I think just make sure if you're still at Augsburg, make sure you get as much grants and financial assistance as you can, whatever's available. Because I graduated from Augsburg with a lot of debt, even though I had some scholarship and grant and everything, and then packed that on. And they do have some scholarship opportunity and grant opportunities for some medical schools as well. So I did not know that as much when I was just trying to get into a school. So I really didn't have the opportunity. But when I got into the school that I was at, some of my classmates had different scholarships and things. So there is that opportunity to look at when you go to medical schools.
There's military scholarships as well. So I'm actually one of the Air Force scholarship people. So if anybody has specific questions about that, I can answer it, but it's like a whole other long topic.
Adam, do you want to say something about, the commitment that you have to the Air Force?
Yeah, so basically my commitment is 4 years payback time. They pay for medical school, you get a stipend during it. The commitment during medical school is pretty minimal. As far as, you have to do some away rotations, 3rd and 4th year. 1st year you do like officer training school in the summertime. It's like 4 or 5 weeks. So it's pretty minimal, but then, there's a lot of restrictions as far as, getting selected for residency, and it's a very complicated process, but, if you're interested in serving and in doing that, it's not a terrible option.
Just a quick FYI in case people didn't know this, but in medical school, they do give you a living stipend with your loans. So you don't actually have to have a job. You still get like an income, even though it's borrowed money, but it's still better than not having it to pay rent. So it's not really that stressful until it's time to like pay back the loan, I'm sure. But right now it's great.
Yeah, I think I was more stressed during undergrad and like that summer before with money, because after that you do have loans and whatever. And then after that, you can do public service loan forgiveness if that's something you're interested in. So even if you don't join like a specialized program for repayment, many jobs are in a nonprofit hospital or not-for-profit hospital, and then theoretically, you're eligible for this public service loan forgiveness program if you join like the right repayment type, and then you do that for 10 years, whatever amount that they want you to pay per month. So I think I was the most stressed in undergrad, just paying for stuff and like paying for my MCAT and trying to figure out like, do I need to take a prep course, and how do I pay for the prep course? And during my gap year, just like paying for life during that. So just know that I think that's the most stressful time, and applying for as much as you can during undergrad, and figuring out ways to have your summers get paid during your summers. If you possibly can do paid research, I think that's helpful. And I think Tori's here now.
Yes, Tori just joined us.
Hey guys.
Do you want to introduce yourself, Tori?
I absolutely can. Hey everyone, I'm Tori Barr. I am a med peds doctor at Gillette Children's Hospital in St. Paul. I'm also a mom. You can see my 4-year-old, and I'm breastfeeding my 4-month-old too. I am an Augsburg alum from 2009. I took a year off, then went to medical school at the University of Minnesota, where I graduated in 2014, matched into the med peds program, and finished that up in 2014. Then I was chief, am I off by years? I was chief resident for a year. And now I am out in practice at Gillette. So my practice is complex care and transition from pediatric to adult care. I think I have the coolest job ever. Anything else you want me to talk about, Katerina?
I think that's fine as far as the intros. I'm just going through some of the questions that students have submitted. I will try and get through as many of the common questions as possible. And then what I will be doing is putting everyone out into breakout rooms in a little bit, so you'll have a chance to talk a little bit more in a smaller group setting with some of the panelists as well. But just to get to some more of the questions, would all of you talk a little bit about the MCAT prep process that you took. I know it's going to look very different for everyone, but I think it speaks to how unique that process has to be depending on where everyone's at. So maybe some of our students, current med students that have taken the MCAT a little bit more recently, do you want to share some of your experiences there?
Yeah, I can talk about it because I actually am kind of passionate about that. I took an MCAT prep course through Kaplan. I think it was worth every penny I paid for it. They are expensive, but from the beginning of my MCAT prep course, I was getting like, I don't know what year you guys are, if you're prepping for the MCAT or not, but I was getting like around the 50th percentile, like a 500 when I was starting, and my score increased by over 10 by the time I actually took my MCAT, and I don't think I would have been able to do that on my own. So if you're someone who doesn't trust yourself to do the structure on your own, the Kaplan course is super, super helpful. I studied for the MCAT during softball season at Augsburg. I was taking a 18 credit course load, and it kept me on track with studying. So I think it was completely worth it.
I obviously took the old MCAT, not the new style, but I would say a couple things. I also took a Kaplan test course prep. I did like a 6-month long course, and I would not recommend that. I think for at least my learning style, to have a shorter, more intensive study period where I could actually like focus on that was would have been more effective for me. It was hard when I was like 4 months away from the MCAT to devote time to that when I had like a biology test coming up next week. It very much got pushed to the side. And then I did teach at Kaplan after taking the MCAT as well. So I think it's worthwhile as long as you kind of think about time and effort and just using that as kind of thinking about it as an extra course that you're taking.
I see Mahad just joined us. Mahad, do you want to introduce yourself quickly?
Hey, hi everyone. My name is Mahad. I graduated Augsburg in like 2012, I think. I went on to do a master's in public health at Dartmouth. Then I came back and I did 4 years at the University of Minnesota. I graduated in 2020, and now I am a surgery resident at the University of Michigan. And I will be going to University of San Antonio, University of Texas San Antonio in a few short months to start radiology residency.
Okay, thanks, Mahad. Did anyone else want to share anything about their MCAT prep experience?
Yeah, I can share a little bit.
Okay.
So I took the old MCAT right before the season, right before they changed over. And I think the big thing, I also took a Kaplan course, which I found pretty helpful. I think the biggest thing I found helpful was finding other people to study with. Me and Seedith, who's here, we would study together for months, and almost every weekend we would make out some time. And I think that was extremely helpful. We had a group of like 4 or 5 of us that would sit in the library and just go through things, go through videos, talk things out. And I think that's really beneficial if you know other people that are kind of going through the same thing and kind of asking questions. And but yeah, I think there's a lot of good resources on YouTube nowadays. And I know back in the day we used to use the Khan Academy, but there's a bunch of stuff on YouTube now that's very helpful. So lots of things out there, and try to find some people to study with. That's what my kind of tips for you guys.
I'll piggyback off of Anil. So one thing I want to advise everyone is if you're going to study for the MCAT, make sure, I think Tori said it, you are like dedicated. What I did was, it took me a longer time because I would study for a little bit and I had jobs. So I tried to balance everything, and that did not work in my favor. So I would advise that if you're going to study for the MCAT, I mean, if you want to do the short intensive, you know, really make it your priority and treat it like a job. Studying for the step now, I'm treating it like a job. So just be very focused and try to retain as much as possible.
What was the question? Is this about how to study for the MCAT? Was that
Yes.
the question? Any sort of standardized test, I think, in my experience, is I don't know if this applies to the MCAT. I think it does, but having done step 1, step 2, and eventually step 3, I think if you can, like, it's pretty much well correlated that the number of questions that you do, the more questions you do, the better off like your score is going to be. So there was a guy in my class before we even took step 1, which is the first in a series of licensing exams, and it used to be the one that kind of determines what kind of doctor you could be. It's kind of going away because it's pass fail now, but he did 10,000 questions before the first practice test was even like assigned to us, the first official one, and he slayed it. Like he scored like 250, which is like, I don't know, something in the 90th some percentile. And what that taught me was like, this is all just about how many questions you can crank through, because you're going to be seeing the same concepts over and over and over. And then by the time you get to the test, you're not seeing anything new.
I totally agree with that. So when I actually took the MCAT 3 times. I took it right after I left, while I was at Osberg the last year. And I studied like in between jobs. I was working at the coffee shop at Osberg, and I would sit to the side with my book and then get up when somebody wanted coffee. It just was not a good ideal situation. And then I did my summer program where we studied together, did more questions, and definitely I improved. But throughout each step, I continued to do more and more questions, and I improved drastically over the years to, scoring very highly on my board exams for surgery. So, and it was all about doing more and more questions and making sure that when you go through questions, you understand why you got something wrong and going through each answer, and really understanding the question.
And that is key, what Kanisha just said, going over the explanation for the questions. I try to do a lot of questions because, I wanted to get through all my questions to be able to just get the numbers up. But there comes a time where you have to actually sit down and going over the explanation. So sometimes it's worth you going over 10 questions, like be focused, understand where you got it wrong, and kind of build those strengths. And then the numbers will come. You will steadily increase the amount of questions that you are doing. So just pay attention to your weaknesses. That'll go a long way.
Hannah or Allie, did you want to add anything else?
I agree with everyone else. Like, it's definitely about like thoroughness rather than, or quality, not quantity. That's what I'm trying to say. Just like everyone had said, like, don't just study and think by putting in 10 hours you did a great job, when that 1 hour could be more beneficial. And that's determined by how you study best. Like, don't compare yourself to your friends or other peers if they study in a different way than you do. Allow yourself that break if you need it, in order to be the most effective for yourself.
Moving on, Maxwell asked about how many schools you applied to and how do you personalize your applications to all those different schools?
I think the year I applied, the average number was like 19 schools, which sounds like a lot, but it's very easy to get to that number, if not much higher. And it's definitely dependent on your maybe financial abilities, if that's only what you're devoting your time to, because it takes a lot of time to to perfect your application and do all the supplemental applications after the normal like MCAS or ACOMAS standardized ones. And it was very hard to personalize some essays for each school. Like for me, what are your ties to Louisiana? Nothing. I don't have any ties to Louisiana. So you're just trying to grab on to like cultural similarities and somewhere like for the Midwest, for example, I've never been to Indiana, but I could say it's maybe a Midwest state or whatever. So it was a little hard, but then you have to ask yourself, like, would you really want to go to this school? And maybe find the schools that better fit your personality and what you want as a career.
I think it's really important to make sure that you are discussing things with someone like Katharina or maybe friends and family, and just making sure that you are casting like a broad enough net. Like Hannah was saying, like 19 is a very reasonable number. I think I had around like 17 or something, but I had friends that applied to like 30 plus or something. And you get to the point where you're going to get secondaries from all those schools. And in order for you to fill them out correctly and on time and actually put like good quality content out there is just really, really difficult to do. So you kind of have to balance between making sure that you're applying to enough places, but that it's reasonable you're applying to those places. I would make sure that you're looking at how much they accept out-of-state students. Is it a public or a private school? Making sure you have a good range and a total number, but also making sure you're not going over that, because if you apply to so many schools and you write your secondaries and they're not very good, then they probably won't move further with your application. So discussing things with Katharina on like admission rates to schools and just with your friends and family and where you think you might be willing to move to and what seems reasonable for like your lifestyle and your personality, I think is something that people don't always give enough time to. And it's just really important to think through those things, because it is a lot of money. And ultimately you do want to get in on your first try if you're able.
Yeah, I'll second how much time the secondaries take. Like, I think I submitted 16 and I only ended up like for the primary. And I applied to both like MD and DO schools. And I think I ended up like only sending in like half the number of secondaries I got back, because it took a lot of time to get through all of them. And I was working a couple jobs at the time, and it just was like overwhelming to try to get all of them back. But yeah, so it's just a time commitment.
Does that answer that part of your question for you, Maxwell?
Yes, thank you all.
Okay, and how about the other questions that you had submitted? Do you want to ask a little bit more about experiences, or did that get answered earlier?
I can't remember what I said.
Okay, what you said was, what extent of medical experience did you have when applying?
Yeah, I guess my question is that I want to apply to do MD PhD, and I have very little medical experience compared to research experience. And so I'm wondering if anyone has any experience with that.
If I could just chime in, because I had a ton of medical experience, being that I worked in healthcare first. I had over 10,000 hours of healthcare experience, but a school still required some additional shadowing hours. So I would suggest shadowing doctors. That seems to be the number one thing they want with experience. So I had it all over the board, and it didn't satisfy one place. So
I know that's often a concern right now, is the ability to shadow, given that we're still in the middle of a pandemic. I do have some virtual shadowing resources listed on the URGO website, so feel free to utilize any of those 3 that I have listed there. But for those of you that are in your residencies and practicing, are any of you allowing anyone to shadow at this point in time?
I feel like that's more of a thing that attendings allow people to do. I feel like I just saw Tori smile. Is that true? I feel like as a resident, I can't just, I don't, I feel like I don't have that power. I don't know. Maybe it's because I'm an intern and I'm a nobody.
I've never had a med student shadow while I was a resident. Certainly in thinking about currently shadowing, at least at Gillette, we aren't allowing anyone to shadow because of social distancing restrictions. We're actually having difficulty just with our staff being in the same rooms and having a lot of restrictions in our own staff. So hopefully, as vaccines become more readily available to everyone, that will reverse here this summer. But at least right now, we are not allowing shadows at our facility.
And I wouldn't worry about that too much because that's universal. You're not at a disadvantage compared to anybody else because that's just across the board.
Yes, and that's a really good point. Everyone that's applying during these cycles will be in that same situation. Something that was added in last year's application cycle, there's a question that all schools asked as part of their secondary. There's a COVID question that asked about how your life has been impacted by COVID-19. That will continue to be asked again in this current application cycle. But I think if I could just ask our panelists to talk a little bit about how the practice of medicine has changed, or has COVID had an impact on why you're choosing to practice medicine?
I can tell you that in New York, COVID really scarred New York as a state, and all of my attendings are scarred, like, from the whole experience. Now it's getting better, but I'm still seeing COVID patients every day. So
From like an application perspective, if I was a school, I'd be looking at a student who seemed like they were flexible and resilient and things like that. Like I would answer it from a point of solutions, not problems, when you're looking at things, even though, you know, realistically it's been awful, but I would try and not highlight that, you know, when you're filling things out.
Yeah, I agree. As a critical care attending, we took care of a lot of, we've been still taking care of a lot of COVID patients at Grady. And one of the things that made it work was that many critical care attendings, medicine, surgery came together and split off the patients in a certain way and worked together. And so, you know, I really agree with Stephanie that you really have to have resilience and you really have to show that you're willing to adapt, because right now I'm still taking care of patients. I'm even taking care of medicine patients that do not have COVID, but because the medicine doctors are so overwhelmed in our ICUs that we were like taking care of way more patients than we ever did before. And so I think that it really adaptation is key. And I think that's one of the highlights of COVID in most hospitals with physicians and nurses and everything, is that everybody kind of adapted and worked together. And that's what you should highlight if anyone asks you about a COVID, how you dealt with COVID. I mean, we adapted, and you're adapting by doing, you know, you've adapted a lot over the last year. So just think about how much you've adapted and dealt with. Talk about that.
I can say, oh, sorry. As a student and a second year student at the time, it actually, I found a newer level of admiration for physicians, and to see how they, and all health professionals actually, put their lives on the line. Because a lot of times, you know, for me, you know, going into medicine, I thought of doctors as, you know, they are high pedestal, you know, going into work every day, saving lives. But when we see how the impact of COVID and how it took a toll on healthcare and everybody in general, it just made me admire the profession, even more, and put a level of respect, additional level of respect for it. So
So I'm an outpatient doc, which means I work in a clinic and not in the hospital. So I haven't necessarily seen COVID patients acutely. My practice has gone from 100% in-person visits to 70% virtual visits in 2020. So I now see patients from my basement office, and log in and see patients all over the state of Minnesota. The patients I see at Gillette are the most complex patients out there. So patients with wheelchairs, trachs, use ventilators to breathe at baseline, have G tubes, feeding tubes, maybe can't talk. So they are like some of the most vulnerable patients in the state, in terms of if they were to get COVID. So it has been a really interesting change in terms of providing this new access to care. And it certainly has brought to light all of the important socioeconomic things that affect patients' abilities to have good outcomes. So on one hand, virtual care has made it possible for people that live in rural areas in Minnesota, South Dakota, North Dakota to get care that is equivalent to if they lived in the Twin Cities area. But on the other hand, for families that don't have smartphones or internet access or those sorts of things, it has, further widened the gap of disparities in healthcare. So it's been just so interesting to learn. I don't want to do virtual care forever, but I think for outpatient doctors, virtual care is probably going to be here to stay on some level for the long haul. So it's been a change in outpatient practice for sure.
I don't know how it's been for the other students, but my school's changed a lot of policies. And like we have to quarantine on location. They've limited how many like out of town rotations we can apply to. Like there's just been a lot of changes. And I don't know, I would just if they ask you a question like, would you be willing to do this, willing to do that, I would probably just be really open to different things that are going on, because I don't know, it's just like developing as we go. And so who knows how it'll be when you guys enter rotations. But I've seen COVID patients, I've worked in the hospitals and all that. Like you're like, it's not like school's pause. Like I'm still in the hospitals every day. So just be prepared for that as well.
Okay, and if I can ask all of you just to touch on a couple of questions here. What advice do you have for someone when they feel discouraged, and what do you recommend to prevent burning out?
I just talked, but I'll talk again. I always tell myself like the most successful people in the world also have the most failures, because you have to put yourself out there in order to achieve big dreams and big goals. And so if you're going to put yourself out there, you have to just realistically expect some no's and some like doors closing in your face. And that's just part of the process. Don't take it personal. And, I also have a rule is don't take any critique from somebody who you wouldn't take advice from. So.
If you're passionate about something and you feel discouraged, like don't give up on it. If someone tells you no, don't give up on it just because they told you can't do it. Like this is something that you've been working for, so don't let them change your life that much. Don't give them that power.
Yeah, I would say two things. One, it's okay to struggle. I cried about Gen Chem a lot my first year at Augsburg, but I made it. And then I would say look to people for advice. Mahad gave me so much advice my first year. So look to the people at Augsburg who can give you advice. And when you're in med school, look to residents or attendings for advice. Look to the people that you trust, because everyone wants to give advice. Like, we're all here tonight because we want to give advice. We all want to help each other. We're in it to help each other, right? So.
I would say, well, thank you for the shout out. And I will return that shout out by saying Tori gave me a bunch of advice and has always been quite supportive of me. Even when I was a medical student and she would like randomly text me and I'd be like, huh, this is so nice. Somebody cares about me. So, and if you see me waving, like I'm waving at her baby right now. So that's who that is directed to. But anyways, in terms of getting advice, you should get advice from a broad a variety of people. Not all of your information should be coming from one person. You should get advice from multiple sources, and then it's up to you to take that information and figure out what is useful and what is not useful and how you want to apply it. One person can't make you or break you, is my thinking on this. I didn't get as far as I did based on any one person. There was multiple people that were counseling me, multiple people that I was listening to. Some of the advice that I got was garbage, and some of it was really great.
So the hardest thing for me, maybe on my confidence or my ego, or I don't know, but everyone's like, oh, you're pursuing medicine, you must be really smart. And Augsburg was not easy for me. Like, I worked my butt off, I'm sure, like the rest of us. And there were a few like secondary applications where I had to choose two personality traits that made for a great medical student. And man, the list is endless. Like, and so many incredible traits are out there, but I did choose stubborn and determined, because that is what I would respond with when people said, oh, you're so smart and whatnot. And I had a lot of like self-doubt with my intelligence. And then I'm like, well, I'm just stubborn and determined. Like, this is my passion. This is what I've decided I want to do. And it takes a lot of introspection and like coming over even that self-doubt that I inflicted on myself. And so just find your outlets. Like, my mom doesn't know anything about med school, but she's my mom. And so she says, like, keep going, honey. Like, I'll bring you some coffee. And like, just those little things. And even like avoid people who don't bring you that energy and that joy and that good advice. Like, maybe they're trying, but just doesn't help you. So don't reach out to them again, I guess.
I had to have a list of the reasons why I'm doing this. That gets updated from time to time because it's changed over time. I also occasionally will pull out my med school personal statement, which I wrote back in 2009, to just remind myself why it is that I'm doing this and what it is that I get out of it. That has been a useful tool along the way, just to remind myself that, you know, this is a hard journey to becoming a doctor. It's totally worth it in my book. But other people that make it all the way to the end don't feel the same. So putting some effort in at the beginning to really know what you're getting into in terms of what does it look like to be a doctor? And is that what I actually want it to look like when I'll get done with this? Because, you know, it's not like television shows. There's a lot of stuff you have to do and insurance you have to deal with and letters that you write for what seems like no reason. But if you can remind yourself why it is that you want to do this, and if that is still in alignment, then it's going to be worth it for sure.
And I would say don't lose yourself in the quest to become a doctor. Don't forget who you are and what you like to do, you know, your passions. You know, some people like to write. I always like to write, but I stopped writing as much because I was so focused on school. Some people like to cook, those types of things. You know, keep doing those things throughout. That's your way to prevent burnout. And then wherever you are, there's always resources, wellness resources and things like that for burnout. Or it could be like me where I told my boss I felt like people were getting a little burnt out and we needed wellness, and he put me in charge of the committee that so, but it's important to think about those things, and it doesn't end. I mean, throughout your whole career, you'll have to be focused on pieces of yourself, your family, things like that, in order to not be discouraged and to avoid burnout.
The other thing is it's okay to say this isn't for me. So I had this huge stress during my senior year at Augsburg of like, is medicine really what I want to do? But I've told my whole family and everyone knows that I want to be a doctor. And this is what I've said from like the time I was in elementary school. And I had like this huge identity crisis of, well, what if I don't do that? Like, and I realized that I was worried about the wrong things. It doesn't matter what anyone else thinks. I'm the one that has to put in the time to be a doctor and to come up with all of this. So just make sure you're not doing it because you feel an obligation to other people, because that's what you've always said. It's okay to change your goals.
Anyone else want to add some advice? Adam, Anil?
I would agree on the burnout piece that Dr. Williams talked about, keeping those activities that, you had before med school and everything, cooking, riding bikes, birding, going out to trivia, drinking beer with your friends. Like, obviously medical school's stressful and it's busy and it's a serious thing. You have to put a lot of work into it, but you need to have a little bit of time to release as well. So.
Yeah, I totally agree. I think it's important to remember too that medicine is obviously a big part of all of our lives, and it's a big part of who we are, but it's not the only part of who we are. We need to keep doing what we love to do, and with keep pursuing your passions. And I think another big thing is knowing and just continuing with your support system that you have now, and just making sure you're keeping in touch with family, friends, whatnot throughout medical school, because they're the ones that's going to be there for you. And I think that's been really helpful for me, at least, having that support system and just doing the things I like to do in my free
time. Okay. Another question that individuals have asked is, when did you take the MCAT and how did you get started on the whole application process? And along those lines, do you have any suggestions as far as how to stay organized with that information?
I highly recommend having a document on your computer that you just have like a calendar reminder once a month to just like add any relevant material to, like update your CV, so that when it comes time to apply, it's all in one place. Super, super helpful, because this whole application process, you like do a gazillion times along this pathway.
Yeah, that never ends. Keep your CV updated because it just never ends. Like for residency, fellowships, research, jobs.
I just had a meeting today about promotion where we went over my CV. So yes, keep it updated.
In undergrad, one thing that I found helpful was I had a Google document. And so instead of updating a CV formally, I just listed every single little thing I did in this Google document. And then when I went to apply to medical school, I could just add up everything. So I knew exactly how many hours that I did volunteering, that I was on some little panel, you know what I mean? And I'm still doing that now. So when you want to update your CV, it's easy.
I would say I was like a bloopers reel of what not to do to get into med school, but it all worked out in the end. But my biggest thing was I didn't even know that you're supposed to sign up so in advance to even take the test. So even if like, you know, I don't know, like look and see when the test is available to even take and check the timeline. It's like, don't get your wedding dress 6 months before the wedding. You got to do it before that. I don't know, especially during these times, I'm sure it's even harder to get in to get tested. So it's better to just have it way in advance than to not have one on the books, I guess.
I also think a good place to start is when I was applying to med schools, I didn't really know anyone that went through the process, so I was completely clueless, and that made it a little tough. But a good place I started was I made an appointment with Katharina, and she was super helpful to kind of walk me through the steps. And I think that's important to check in with her or Dixie, or I don't know who's running the program anymore, but yeah, I think that's a really good resource Augsburg has, and they really walked me through the entire process and what I had to do, class I had to take, when I should take the MCATs, and I think that was very helpful.
Yeah, earlier the better. Thank you, Anil.
Another thing I would recommend, in addition to meeting with someone like Katharina, so you can get all of those dates in line and figure out what you need to do, is really listen to her and especially go to her boot camps when it comes to writing. I've had a lot of friends recently apply to medical school who have amazing resumes, and I see no reason why they haven't gotten in, and they haven't. And I think it really is that they're not spending enough time on their actual application. I think students really get wrapped up in like finishing out school and doing well in your MCAT, but if you just kind of throw away your secondaries or your personal statement or your supplemental essays, your letters of rec, like those things really matter. And I think it's easier to kind of be like, oh yeah, like I'll work on my personal statement this weekend or whatever. And I've heard that so many times, and it takes so much more than just like going to a coffee shop and like working on it for a few hours on a weekend. It takes a lot of time. And if you're able to, or you have people in your life to be able to look at it, that's what I recommend. Katharina has probably the best eye, but I had a lot of friends in like a research lab that would look at it, or just other friends who don't normally read things like that. So you can get like editing done from so many different people and just get as many eyes on it as you can and write a lot of drafts. And it's not the fun work, but I think it's super, super important, and it gets kind of put to the back burner a lot.
Yeah, the boot camps, I would agree, were an amazing way to force me to work on it for sure. Like a gym buddy, but one that is like knows their stuff. Katharina is a great person to run it through.
Anything else anyone wants to add about timing? You know, when did you take the MCAT compared to when you started working on your application?
I think it's important for you to decide if you like want a gap year or not. Not that that always works, but I didn't want to take a gap year if that was possible. I wanted to go straight through. So I took my MCAT at the end of my junior year at Augsburg, and then took a couple week break after that, and then immediately started working on my application that summer. That worked for me. I ended up getting in like that time, but I think you want to think through if you're ready to go straight to med school and keep studying, or if you need a year to recharge and work for a while. It's stressful. I wouldn't suggest rushing into med school unless you're confident that you're ready, because it takes a lot of time and dedication once you get there. So that's just something you have to think of for yourself.
That's really good advice. What I'm going to do is, I know some people may have other questions as well, so I'm going to put you into breakout rooms for a little bit, and then we'll come back and reconvene because some people have submitted some additional questions, which we can just touch on at the very end after we reconvene. So I'll give you about 10 minutes in the breakout rooms. Okay, so I'll move you all in here and get you started here. Okay, I'm having to manually move some people because the automatically assigned rooms did not go through for everyone. So just bear with.
Didn't like didn't like not being able to make my own decisions for my patients, which is kind of why I pursued medicine. But I honestly didn't intensely pursue like PA school ever, or like shadow a PA or any of that. But all of them that I've met now are super great, practice on their own, don't need like it. You have almost as much independence, and I think it's a great path.
So thank you.
I didn't realize either that PA school was equally or if not more competitive than medical school.
Yes, very, very competitive.
Yes, I think we probably have more people applying to PA school than med school right now at Augsburg. And as it turns out, we have our two PA students in this room. So I just thought I'd pop in for a minute. I don't know if Annika, do you end up working with a lot of PAs in emergency medicine?
Yeah, we have an area that I guess we call super track urgent care. And the PAs kind of are stuck in that area usually, but they all seem really happy with their job. And I work directly with them all the time. So
I know like a lot of the surgeons that I've worked with have PAs that work with them. Usually, if you're interested in the surgical side, at least from what I've
Oh, hi, Katharina.
Hello, I'm just trying to pop in some of the rooms and just see how everyone's doing.
Yeah, we're doing well.
Are you getting some of your questions answered, Lily?
Yeah, I told her I'm kind of leaning towards vet school, but we talked a lot about like balancing like your education and other things you like to do. So that was helpful.
Okay, good, good. Salma, Mohammed, are you getting your questions answered?
Yeah, she did answer.
Okay, okay, good, good. I'm just gonna step out again and send a message to all of the rooms here. Okay, do we lose some folks? It looks like we lost some folks in the breakout rooms. So I will make note of that for next time. That might not be the best way. It looks like here they are now. Okay, I was afraid I had lost some of you in those breakout rooms, but hopefully you had a chance to ask some additional individual questions while you were in those breakout rooms. I just wanted to touch on a couple of things that have come up as far as other questions. there were some additional questions as far as, what's a good baseline GPA to have for applying to med school. I don't know if there's a really good answer for that, as most schools will say that they do a holistic review of applications. And so that can really mean anything. I think if you look, there's a pretty broad range in terms of GPAs. And if you look at MSAR, that's a really good resource as far as typical GPA ranges for different schools. There was another question as far as, let's see, what was it here? If I can pull it back up in the chat box here, if we haven't lost it already. There was another question as far as just how many hours do you need to have of shadowing versus other experiences. And again, I don't know that there's one set answer for any one of the schools. I think for those of you that are DOs or in osteopathic schools, I think the typical recommendation is that you have at least some shadowing experience, preferably with the DO, although most DO schools will accept shadowing hours from allopathic physicians as well. One thing, there have been lots of changes in application requirements this past year because of COVID. I do have a clearinghouse of all of the different centralized application services, professional associations, and all of the changes that have come up because of COVID. And so different policies are still in flux and they're still changing as far as lab requirements, whether they'll accept in-person or online only. So make sure that you check some of those resources as well. Something else to pay attention to, this has come up from quite a few students where there have been some schools this current cycle that have gone MCAT optional, in that they started reviewing applications prior to MCAT scores being received. There were lots of delays and lots of test cancellations as states went into different phases of lockdown. And so students were having tests canceled and they weren't able to reschedule for more than 3 months. And so for that reason, during this current cycle, some schools did not require an MCAT per se, or they did not take the MCAT scores into consideration. At the most recent workshop that I attended regarding the MCAT, and this was just two weeks ago, I think, there are not any schools that are going MCAT optional this current cycle. So schools will require the MCAT. So bear in mind that that's not going to be a good reason to put together an application to try and get it in, because they might not take that MCAT into consideration. So just make sure that you keep in mind, it's better to not apply until you have that competitive application put together at the time that you click submit, okay? And I think that's probably one of Dale's best pieces of advice, and he always says, don't apply until you're a competitive applicant. And so that might mean waiting, it might mean you need to do a little bit more beforehand. Okay, but I think that touches on most of the questions that have come up. Are there any other outstanding questions that anyone has? Okay, any last pieces of advice from our panelists, our alums?
I highly recommend a gap year. It was awesome.
I second. A gap year gave me a lot of clinical experience that I think made me a more competitive applicant, especially given my MCAT that was not the most impressive. And I would also say, people will tell you this, and it's true, that every year gets better. Like, through med school it gets better, then through residency, I think it's going to get better. So it gets more and more fun.
Katharina suggested I take a gap year because I wasn't competitive, and she was absolutely correct. And I was really glad that I did listen to her and did that, and just take that pressure off of yourself. And there's no, the worst case scenario is a gap year. Like, it's a lot of people enjoy theirs. I enjoyed mine. So
Yeah, I agree. I think it's a good idea to take a gap year. I had a few gap years. I think one is good enough, but it really allows you to mature. You can tell the people who enter medical school without a gap year, they have some emotional growth that needs to happen. I mean, they're mature. So I think you should do it, at least one. And honestly, I want a gap year right now. Surgery residency is brutal. You can tell, like, I'm so sleepy right now.
Yeah, once you get on the train of med school, you're on it. So you go like 7 years straight. So at least 7 years straight. So take advantage.
Anything else?
I think make use of your connections. So like all of us here have great connections at a variety of medical school. Like make use of us any way that you can get your name better known by whoever is making those decisions is going to help, because everyone applying, or most people applying to medical school, are great applicants. So any way to make yourself stand out a little more is super helpful.
And you have all sorts of tremendous resources in terms of alumni that were here this evening. We have some other alumni who weren't able to be here because of work conflicts, scheduling conflicts, and many of them have also offered to serve as resources. I think given how difficult it is to do any sort of shadowing, oftentimes schools will take into consideration any virtual informational interviews that you've done, anything that will help you get a better sense of exactly what it is that you're getting yourself into potentially, is what schools are looking for. So take advantage of those resources that you have. Lots of virtual workshops, things like that. Schools will also take that into consideration instead of just shadowing experiences. Several of our alums had to leave because of other conflicts, and so they've left their contact information in the chat box. Again, this will be recorded, but of course, always feel free to let me know if there's anyone in particular that you would like to speak with. I can certainly provide you with contact information and do some e-intros just to get people connected. Okay, and the same with faculty as well. I think oftentimes faculty are alum of different institutions, and that goes a long way oftentimes in terms of establishing those relationships. When I attend conferences, I try and make sure that I connect with those admissions directors, and oftentimes some are willing to do an off-the-record review of application materials beforehand. And so I think anytime you can utilize those kinds of resources, try and do that. Okay, but thank you everyone for your time. Alums especially, thank you so much for taking the time to come back. It's been so great to see so many faces. I think the hardest thing for Dixie and I to ever get used to is not being able to hug people, because we're both such huggers. And so that's going to be one of the hardest things for us, I think, as we move forward. But definitely thank you all. Students and alums that are applying to med school. Hopefully this information has been really helpful. If you have additional questions, don't hesitate to follow up, and we'll try and make sure that you get those questions answered. Okay. Anything else? Okay, well, thank you all so much. Dixie and I are forever in your debt for the resources that you're able to provide to us and our students that we serve. So thank you all. Take care and be well. And hopefully we'll be able to see each other in person again in the near future. Okay. Have a great evening, everyone. Thanks.
Thank you, Katharina.
Thank you all. It's so good to see you all.
Thank you, guys.
Take care. Take care, Mahad. Get some rest.
Thank you all.